Hello, it's Peter Wright and Kathleen Beauvais with another episode of the Yakking Show. This is your source for health and wellness, and we help you with that source by bringing expert guests, and today will be certainly no exception. But first, let's introduce co-host Kathleen. Hi, Kathleen. How are you today?
Oh, I'm doing great, Peter. Thank you. And thank you also very much for tuning into our show. We so appreciate having you. And Peter, today we're delving into the world of cupping. Yes, so if
Hmm.
you haven't heard about
Interesting.
this, you'll be interested to it's piqued my interest a number of years ago, and I'm anxious to find out some more information about it. But first, let's introduce our guests. Dr. Tom Ingegno, welcome to the show. How are you today?
I'm doing great. Thank you, Kathleen and Peter, for having me. I'm sure there's going to be a fun one.
Yes, Dr. Tom is a doctor of acupuncture and Chinese medicine, an integrative health specialist, and the founder of Charm City Integrative Health. Beyond his success inside his clinic, he's a featured healthcare expert, holistic health trailblazer, and the author of the book, The Cupping Book, Unlocking the Secrets of Ancient Healing. And as I mentioned, today he's here to yak with us about the ancient healing modality of cupping as well as other modalities. So once again, welcome, Dr. Tom. First, can you explain exactly what cupping is?
Yeah, so cupping is a therapy that's been around for over 5,000 years.
Wow.
And the nuts and bolts of it are you create a vacuum using a jar. Classically, they were buffalo horns, pieces of bamboo, clay pots. Today, we have glass jars for fire cupping, and then we have a whole slew of plastics and silicone cups that don't require any fire. But the idea is we make a vacuum and we attach that to the skin, and it pulls fresh blood through that area. It actually increases blood flow significantly for injured tissue.
It makes me wonder, though, how on earth was it? Did you say 4,000 years ago?
At least, so we know the oldest thing is the oldest written text we have on is 1515 BC, the Ebers Papyrus, and clearly, if it was written about in a Egyptian, medical text, it
Mm,
was practiced for a lot longer than that. We actually
right.
don't know exactly where it originated or how, but you're absolutely right. The idea that we were sitting around thinking about these things back
Yeah,
then and coming up
Yeah.
with it is just breathtaking.
Wow, that is
absolutely.
amazing. Yeah. So what are some of the common conditions you would use it for?
Yeah. So the number one, neck, shoulder pain, low back pain, right? That's that we have, modern day in the last 5 years, some really nice systematic reviews, some great studies on it. Respiratory health is a classical use. So
Okay.
things on the upper back or the upper chest when somebody has a chest cold and they can't break up that mucus or that congestion, this can really help because those cups, when they're attached to the surface, this sounds insane, up to 6 inches into the body, we see an increase in circulation. So I'm a pretty big guy. That's halfway into me.
That's right. Yeah.
you know?
Wow.
Oh,
So is it akin? I I've been a farmer a lot of my life and a great horse owner for a lot of my life. And there was an old traditional remedy for horses with damaged tendons called pin firing, where it's sort of banned now because it's somewhat cruel, but you make little burn pricks down the foreleg above the tendon, and it increases the blood supply. And they found this was a really good remedy for strained tendon. Is it the same sort of principle that you are increasing some irritation in the body, which brings the blood in?
All right. First of all, you're going to send me on a deep rabbit dive for what did you call this again? I have to go down that
Pin
rabbit hole.
pin firing.
Pin firing. So
Yeah.
I'm actually, in addition to cupping, I'm also certified in animal acupuncture. So
Ah, there you go.
there's a technique where we do moxibustion, an herb that we burn on or near the surface of the skin. That sounds kind of similar,
Yeah.
but all of these things fall into this term that sounds so horrible. Micro trauma. What am I
Yep.
doing? I'm
Yep.
creating a little bit of tissue damage or disturbance to that tissue. So our body's natural response is we have to send fresh blood to that area to stimulate the body to heal itself.
Yep.
It's almost like a physical way of doing homeopathy, right? Like
Yeah. Yeah.
causes cures like. So what am I going to do? I'm going to hurt you just a little bit to get that going. But with cupping, rather than heat in that case, yes, we're physically playing with, a negative pressure to pull blood or the tissue apart, separate the skin from the fascia from the muscle, and create this void in this closed system to pull blood in behind it.
Yeah, that's really good. And I've got to ask a technical question. To create the vacuum, so you
Yeah.
you heat the vessel so that you get
So
rid of the air.
tricky. We don't want to heat the vessel. We would just want to eat the oxygen out. So
Okay.
that's why in this book I'm writing about the modern tools, which are like, they have a one-way pump, so you can pump. They're made out of plastic or silicone ones that actually press against the surface of the skin, squeeze out the air.
Okay.
Rather, much safer for you to do at home,
Yeah.
much easier. You would remove the risk of fire, glass breaking, all of those things. But this was traditionally practiced in homes. This was folk medicine. Grandmas across the planet did this.
Right.
So,
Interesting.
Dr. Tom, any chance you can demonstrate this for us?
Of course I
Ooh,
can. Give me
big.
1 second. Let me
Yes.
see. Normally I have 1,000 of them laying around, and right now I'm just looking for one. Oh, here we go. Hang on 1 second.
Sure.
So this is how simple this is. Now, you don't have to get fancy pink ones like this. This is a silicone cup. You can see how easily it is to compress. And the reason I like this brand is it has a little handle. So I have some that fit perfectly in your gym bag. You can get them online for about $20, $25. They're like nesting dolls. They look like half handballs cut in half or something like that. So they're just essentially this without that handle. Now this one, very simple. You just press down, you'll hear the air get squeezed out, and then we create a little suction.
Oh, it's like a plunger.
Pretty much.
For those of you who are just listening to the audio, picture a toilet plunger, but a lot smaller so that you can actually apply it to the skin. So that's just for the audio.
I will tell you that I have seen some therapists, I hope they're not acupuncturists, that have used the plunger on people.
Oh.
In the world where everything is mass produced cheaply, why do that? I don't know. Maybe for a zany photo. I've seen people do the old school version with the fire using fish bowls.
Yeah.
Fish
bowls.
And it's got to just be to have that wacky photo. Now, I wish I had some of the buffalo horns here. Maybe I'll send you guys a photo afterwards. But I actually, because I'm bald headed, I actually attached them to the sides of my head just for fun. There's no therapeutic value. Please don't do that at home. And if you do, send me a photo.
But another, Kathleen, a slightly more tasteful application in the real world is if you have an older car like me that doesn't have a built-in GPS and you buy an aftermarket GPS, it has one that looks almost identical to your cup to attach it to the top of your dash.
Yeah,
right?
yeah. All these, I mean, that's essentially it. It's a suction cup, right?
Yeah.
So, okay, so then you apply this to your skin, and where would you apply it and for how long?
Okay, so the range for that is 5 to 15 minutes, and it really depends on the comfort of the patient. It depends on how strong you put this on. So if you're doing cupping on yourself, it's kind of hard to get some of the things in between the shoulder blades and the low back. So you probably want a partner. So this is where you have to give a lot of feedback. Oh, that's comfortable. That's a little too strong. And with these, specifically the suction ones, the harder you press, the harder they're going to get stuck. But there's almost a built-in safety. You're not going to get a perfect vacuum. It's not a big volume of air that you're displacing. So these tend to be, mild to moderate in strength. And with that, normally if somebody's new to cupping, I want them to do a test, right? Do it for 2 minutes, take it off. What's happening, and this is a side effect, but it actually has some therapeutic effect as well, is as you pull that cup in, you're breaking the capillaries at the surface, much in the same way that kids give each other hickeys. So those capillaries, when they break, that's okay. That's superficial. That's not deep in the tissue where we have the problem or the stagnation, the tightness in the muscle. But after those cups come off, it takes about a week for your body to keep circulation going through that superficial tissue to clean up those bruises.
Okay.
So some
Okay.
people have let that circular bruise for about a week or two in some cases, depending on how much, blood is pulled to the surface, how much capillary damage there is. But all of that is part and parcel of the treatment and generally a good sign. But when it gets too dark and in super rare cases, and another reason why I wrote about these different techniques that don't involve fire, they tend to be slightly less intense. So you tend not to get blisters, which some people can actually, if they're left
Really?
on too long or they're too
Yeah.
strong. In my clinical experience of 23 years, I've seen it twice in clinic. And it was just, one of them went on a little bit too strong and they had these little clear blisters. We put some gauze over it, sent them home wrapped up, and they were fine in a few weeks. But it's not something that we want to have anybody cause at home. So that's why I'm leaning more on silicone cups on the
Silicone cups.
pump sets, because you can see visually this is too strong.
So what do people report feeling after having one of these sessions?
So this is great. This is a pretty quick turnaround for pain relief. So if somebody has a lot of muscle tightness,
Yeah.
post workout or injury, they can get off the table and feel markedly better. They will say,
Wow.
wow, this is 60, 70%, in some cases, depending on how severe it is or, the underlying cause, it can go away pretty quickly. It's a pretty powerful treatment. In fact, in China, and this is how it kind of comes to me through acupuncture and Chinese medicine, this was being done in households across the globe thousands of years ago. In about 300 AD, a physician who was well known, we all love to quote him. We talk about his treatments in schools. He actually was the one that said, "Hey, physicians," and I'm paraphrasing here, "I know you think this is beneath you because everyone's doing it at home, but it has so much power that you should be doing this clinically as well." And he kind of solidified it in the realm of East Asian medicine, So that was about 300 to 350 AD. Man's name was Gohong. Sorry.
Okay.
So that's interesting. So when you're applying these, or when somebody decides, oh, I'm going to give this a try,
Yeah.
it's not about placing these willy-nilly. You have to know where.
This is a little bit more horseshoes and hand grenades than, say, something like acupuncture or where we're doing massage along specific muscle groups.
Right.
You can be a little bit looser. If somebody says my shoulder hurts, I want people to think about how their shoulder moves and where they're feeling that tightness. And
Right.
then they can kind of cover that area. We don't want to do tons of cups, but 5 or 6 cups around the shoulder and neck is going to cover a pretty big area. So you can kind of blanket that area and get some good circulation going through. Right? We don't want to keep cupping in the same spots. But if somebody's coming in one day and they get some shoulder work, oh, maybe, a few days later they want to get their back worked on. That's fine.
So, sorry, Peter, I'm just jumping in
Oh, keep
here, but
going. Sorry.
so other than pain management, because I
Yeah.
can see this, how it would really, I could alleviate a lot of muscle aches
Yeah.
and pains. Is there anything else that you have seen in your experience
Yeah.
that this, might help with?
So one of my
Mm.
personal favorite uses for me, and I have my kids actually put these on, just running along the spine for relaxation.
Mm.
This is a cool thing, and a lot of the services we do at our clinic and even acupuncture, a lot of the overarching effects of acupuncture come down to regulation of the autonomic nervous system, right? We're all stuck in fight or flight.
Sure.
So when we increase circulation, our autonomic nervous system goes, wow, there's more blood flow. Oh, I must be relaxed. So it doubles down on that, right? It'll increase circulation more. Our heart rate slows down. Our breathing gets deeper. We start making, those feel good neurotransmitters, and they'll balance out those levels. So I'll put the cups on for 10 or 15 minutes or have my kids do it. And, they'll take them off and I'm snoring. I'm out. I'm cold. Yeah, I'm taking a nap.
Yeah.
And so when you go to remove them,
Yeah.
is there a way to remove them without
Yes.
pulling the
Yes.
skin
Yeah.
off?
Yes. I love the amazing sound it makes. So you actually burp it like Tupperware. One of the ways is you kind of press your finger in. It's always easier with two hands, but you press your finger in under the cup and
Okay.
you break that seal.
Ah, okay. Interesting.
Hmm. So I would guess it could be difficult if you've got a plaster cast on your arm. I would guess if you could get a cup near a fracture site, it would be
Yeah,
beneficial
increased
for
circulation.
increased
Yeah,
circulation.
yeah, and chances are, if you are casted, you're not getting a cup on the tissue itself, but up above. If we think
Yeah,
about that in a more systemic, global way, right? Well, where does the blood flow from? So if it's the arm, maybe you go to the upper arm.
upper arm.
If it's
Yeah.
the leg, okay, go somewhere on the thigh.
Hmm.
That would make sense. So, what motivated you to write the book, and how can
So
people get it?
so there was a few reasons. One, and I had the idea years ago. I mean, there's other books on cupping, but they seem to be more aimed for the clinician when this is really a home therapy. The first thing was I realized even if I work 24/7, 7 days a week, all day, multiple rooms, I'm never even going to scratch the surface of the population in Baltimore.
Hmm.
And to have a global impact and to return a traditional practice back to people's households was, these were the biggest motivations for me. The other thing is, I know that every time we add a zero to a number, it cuts out so many people from that healthcare system.
Hmm.
This, with an initial investment in the book and jumping on Amazon and picking a cupping set you like, maybe that's $50, but that's yours for the rest of your life, and that can be
Sure.
shared with other people. So the idea was to kind of democratize it and demonetize it a little bit, so more people can enjoy it. Those were the big things. And then in 2016, I know we just had the closing ceremony of the 2024 Summer Olympics. In 2016, the day after Michael Phelps popped out of the pool, the local ABC station was recording a piece on cupping.
Really?
In
Huh.
fact, yeah, in fact, the number of people that mentioned cupping at the Olympics this year, now everyone's savvy, right? And I was like, well,
Yeah.
back
Yeah.
in 2012, I saw the swimmers in the background behind Michael Phelps, with cupping marks, and I'm sure they were all talking on that, pool deck.
Yeah.
So as it started to get more normalized, as we had national stars from every country showing up with the marks, it became more of a global sensation. It just made sense to explain it in detail and share the origins of it and share how to do it safely at home and share when not to do it, in a very simple, approachable book for people.
And
Very
you know
good.
what? You're absolutely right, because I was watching some of the diving competitions from the Olympics and noticed that some of them actually did have these funny marks on there,
Yeah,
and wondering, I wonder if they're doing, if cupping is what caused that, but you're probably right.
absolutely, absolutely. And truth be told, a few days ago, I was actually having a conversation with a physical therapist, and he said, "You know what? I think cupping overtook KT tape, kinesiology tape." He goes,
Really?
Right.
I saw kinesiology tape,
Mhm.
but it wasn't as, plastered all over every
All right.
every athlete like it used to be.
Yeah.
More people had cupping marks.
It's interesting.
Absolutely. Oh,
Ah,
s-
and where can people get your book? Is it on Amazon?
It's on every online retailer. If you do not want to support Amazon, that's okay. But yes, it's there, Barnes and Noble and a dozen other small ones. If people are looking for links to that, thecuppingbook.com, I tried to make it as simple as possible. There's a link to all of those. And then if you want more information about me or the clinic, charmcityintegrative.com, we have links to the book there as well.
Okay, no, that's wonderful. Very
now
good.
you have many other modalities that you do at your clinic.
Absolutely.
But if someone were just thinking of starting a holistic approach
Yeah.
to healing, what modality would you suggest they begin with first?
So, the expression is never ask a barber if you need a haircut. You'll end up looking like me. I'm always going to say acupuncture. I'm going to say acupuncture and East Asian medicine
Yeah.
because that's a huge animal. It's an entire system, regardless of what people are looking to improve. Acupuncture can help. I'm not going to say it's going to cure everything. We see a
Sure.
lot of long-term autoimmune disorders, a lot of chronic illness, and we make a big difference in those people's lives. So, whether you pulled your back or you have chronic Lyme, that's where I would start.
Right. Right.
Mm.
Okay.
Yeah, the one that interests me, and I go back to my farming background where I had a knowledge of liquid nitrogen because we used to do artificial insemination of cattle, right? So,
Yeah.
of course, all the semen stored in flasks of liquid nitrogen, so I know how cold it is. And so I was very interested to see cryotherapy on your and the chambers on your website. So,
Yes, yes.
what do you use that for? And B,
Yeah.
how safe is it?
So, it's very safe. Most people that are using liquid nitrogen chambers, there are some electric ones. They don't get as cold. They don't seem to have the same. One of the effects that seems to help is this, release of endorphins, which
Okay.
happens when you get like
Oh,
hit really hard with this cold. Your body does not like that, right? We've just completely changed your environment by you
Yeah.
taking a step into a chamber. So the liquid nitrogen takes you down, and actually it's not the liquid nitrogen touching you directly. That would be a bad time. Uh, but it's the oxygen, the air that's being chilled, right? So there's a little
Yeah.
safety chamber where the liquid nitrogen mixes with the air that's then pumped into that chamber. And that air is chilled to, I'll give you Celsius and Fahrenheit, anywhere between negative 120 Celsius, which is negative 184 Fahrenheit, to negative 160 Celsius, which is about negative 256 Fahrenheit. Now, the idea
oh,
is this intense cold is dry, right? You can't
Yeah.
have water. You don't want to be wet. You can't even have sweat when you're in that chamber. But you get this really rapid constriction from the skin down, right? It wrings you out like a sponge. Now, when you get out, I mentioned that endorphin release,
Yeah.
that comes from your body thinking it's freezing to death. So when you get out, your body goes, I got to warm back up. So it vasodilates, it opens up everything, pumps
Everything.
fresh blood down to those extremities. So the big use is physical pain. Now it's kind of still trendy now, but this was invented in 1978 in Japan
oh,
Wow.
for rheumatoid arthritis. The physician
Really?
that was doing it was going, well, anything with an itis is inflammation.
mhm.
It's normally hot joints, tightness. Well, what's going to do that? Well, let's cause a bunch of constriction. Let's wring that out. So he started playing with this, and it was for like little old ladies. And now we have all these, sports stars and athletes using it for workout recovery, and it works amazing. But long-term physical pain, it does pretty well with.
Yeah.
So how
What,
long
what,
would you be in these chambers? How?
The safety where we see that the benefit risk reward ratio, 3 minutes is the max.
goodness.
Within that time, we get enough of a squeeze to the body, and we know we're on the safe side of giving you frostbite and things like that. And there's all these safety procedures. People wear clogs and gloves so their extremities aren't exposed. Your head is out because, yeah, we're breathing 78% nitrogen now, but 100% probably make you pass out. So we don't do that.
So one of the concerns I've got is I go back to an experience in the mountains in South Africa when I
Yeah.
was on a company retreat or something. And one day we took a walk to a pool that was fed by a waterfall, and it was really cold.
Yeah.
And I got in, and after 2 or 3 minutes, I said, this is not fun anymore. And I got out, and I'm watching, and there's a young girl. I'm watching a young woman, sorry, in her 20s, and suddenly her hand goes up and she goes down, and all I can see is her hand out of the water, and she
Yeah.
doesn't come back up. So somebody else was closer, they hauled her out, and we had to give her CPR. Her heart had actually
Yeah. Yeah.
stopped. So
These are contraindications, right? So if we know
yeah,
there's a cardiac issue, that's a big thing. I mean, the polar bear plunge that they do every January to
yeah,
support Special Olympics or police or whatever organization is doing it. They're pulling people out of the water all the time. That
yeah.
cold shock of a cold water actually is, from what I've read, worse than this chamber. And
Hmm.
part of it is the nature of how it hits.
Yeah.
And this is pulling heat out of the core when we do have a cold plunge as well. We keep it around 40 degrees Fahrenheit.
Okay.
Is significantly warmer than the liquid nitrogen chilled air, but because it's wet, it feels intense. It's so
Right.
much worse. And that's where people really have to be careful if they have cardiovascular issues, And in a lot of cases, just the wrong setting. I didn't eat today or something like that. Somebody who's reasonably young and externally looks healthy needs to be careful. Even when we do cold plunge at our office, we literally have people dip a toe before they get into it. Don't just
Right.
jump in.
So,
Yeah.
Dr. Tom, I have
Yeah.
another question, because you're right. Any itis is some sort of inflammation to the body.
Inflammation. Yeah.
But the inflammation is the body's natural response to
Yeah.
something
Yeah.
not right.
Yeah.
So if we try to contradict what the body is saying
Mhm.
it needs to do, because inflammation
Yeah.
is the body's natural response, and then we go into something like the cryotherapy, and
Yeah.
we want to constrict all of those blood vessels, are we going against the body's natural response in some way?
Yeah. In some way, yes. And what I would say is I'm gonna break this into like a couple of different categories. For people with
Mm,
chronic inflammation, right? That's supposed to turn off at some point. The
yes.
initial is we're gonna mobilize this area. We need to get, fresh blood there. But
Mhm.
what ends up happening is long term, that chronic issue, we have metabolic waste getting stuck in that tissue. We have all these things that we don't want sitting in that tissue. So if it's
Mhm.
long term, yes, with like something like arthritis, especially rheumatoid, that long-term chronic inflammation does more tissue damage. Now, there have been some studies, and this is where it gets weird too, because I haven't seen anything about disrupting the natural response. Yes, it's a protective thing.
Mhm.
What I have seen is one study which wasn't so great, where they were looking at power lifters. Specifically, they were putting them right into cryotherapy after they had them exercise.
Mhm.
Interestingly enough, it did significantly knock down that post workout inflammation, which that's what we use to kind of stitch the muscles back together bigger and stronger.
Right.
Uh, it didn't so much affect the strength. It
Hmm.
affect it affected the muscle mass though.
Ah.
So so they weren't able to get that hypertrophy, right? That
Mhm.
building of the muscle, but they didn't show any loss of strength. Now, the problem was it was like 6 power lifters all within a certain small range, so we don't have a data set for a big group. Now, I would say immediately after working out, don't do it. Immediately after the injury, don't do it. 24 to 48 hours after that, we want to start repairing tissue. So, if you get injured and it's 2 days later, I think you're on the safe side to do cryotherapy, so long as you don't have an open wound or something.
Right. Oh, interesting. Thank you.
Interesting. So here's one for you. You said you also treat animals with
Mhm.
acupuncture.
Hmm.
I guess cupping would work on animals, except that they are hairy. So
Yeah,
you
you would
can't,
have to you would have to
you'd have to
shave them
shave them.
first, and I've never done it. I have one textbook from the 70s that attempted to catalog most of the diagrams that they had on animals in China getting acupuncture.
Right.
And certainly they did moxibustion, which is an herb that we burn on the surface of the skin. I have yet to see anyone throughout history do cupping on an animal. Maybe one of those weird hairless cats, but who knows?
Interesting.
Uh,
Yeah. So here's one that we ask all our expert guests, and you've
Yeah.
already answered Kathleen's question about where
I
should
apologize. I jumped the gun there.
that's
no, not at all.
okay. You've answered Kathleen's where should people start with which modality at home.
Yeah.
But over and above that, we know from dealing with many people in the course of our lives that many people are very negative at the moment. They're worried about all the
Yeah.
bad news. We're not like that. We don't watch too much news anyway, so we can hopefully rise above it. What would you say, in addition to acupuncture, is there one tip for improving the lives of people who are gloomy?
Uh,
What should they do? What would you suggest?
I Look, this is not a fast cure.
Mhm.
But it has had such a tremendous impact on my life. Almost anytime somebody asks me this is the answer I give them. And it took 20 something years of getting beaten into my head before it stuck. Start meditating.
Mm.
Yeah,
Uh,
I mean, 2 to 5 minutes a day if you have a hard time sitting. and trying. You don't have to be good at it. Consistency is the key. Do it daily, every day for a few minutes, and slowly you'll add more time. Slowly those will drop you back to a real calm, relaxed nervous system state, and that keeps your mood better. That'll keep your cortisol levels down. That'll keep your neurotransmitters more balanced. And that's how I asked that. I did something like so touchy feely like meditation and then gave you medical terminology after. But the idea is they go hand in hand. Where our mind goes, our body goes, and vice versa.
Absolutely.
Thank you.
Yeah.
Good advice. Yeah.
Well, you know what, Dr. Tom, we can chat here for, I think, another couple of hours, but unfortunately, we're running out of time. So how do people contact you?
Yeah. And this is the one I jumped the gun on, but charmcityintegrative.com, TIVE at the end of that. And that has ways to contact me directly, book me for podcasts, lectures, whatever you want, as well as check out everything we're doing at our clinic, links to my book, links to some of the courses that we have coming out soon. I don't want to say too much about that because that's a lot of work for me, but charmcityintegrative.com is the best place to find me.
Fantastic.
Kathleen, sorry, can I
Yes.
ask Dr. Tom another question?
Absolutely.
Just listening to him talking there, would you say that the interest and acceptance of alternate medicine, like such as you practice, is increasing rapidly now in the last few years?
Even more so since COVID.
Yeah.
When I started, I still had some older physicians saying things like, "Oh, you better make sure they don't reuse the needles," and just relatively ignorant things like that. And I hate to call it ignorant, but that's what it is.
Mhm.
And now, I'm lecturing to med students.
Yeah.
Why? Because they know that like the current healthcare system is broken and prevention is a lot more cost effective. It's better for the patients. And that's where a lot of these alternative therapies that have all of the hallmarks of evidence-based medicine. They have a ton of research. They have, societal acceptance. They have practitioner experience. And that's really where we get the best results for those patients. And acupuncture, East Asian medicine, and a lot of the stuff that we do at our office is all really evidence-based. And since COVID, everyone wants to take better care of themselves. And
Mhm.
it's really been a boon for our clinic, but we've been able to help a lot more people.
Oh,
Excellent. That's what we're finding. Interest in
yes.
our show. Very much so. Thank you very much, Dr. Tom. Kathleen, back
Thank
to
you
you
so
to finish
much.
off.
Well, it was a pleasure having you on the show today, Dr. Tom. Thank you so much. And thank you also very much again for tuning into our show. If anyone is interested in being a guest on our show, we invite you to visit us at theyakkingshow.com. All you need to do is click on the contacts tab and fill out a short application form, and we'd love to hear from you. So until next time, take care, everyone. Bye-bye.
Bye.